Hello, it's Peter Wright and Kathleen Beauvais in Ontario, Canada, with episode number 45 of the Yakking Show. This is where we talk about life, business, and more, and we bring you tips and ideas for the changing world we're living in right now. As always, we have interesting guests for you. Today is no exception. We have an interesting person to talk to, and it's my privilege and pleasure to hand over to my co-host, Kathleen. Welcome, Kathleen, and you will introduce our guest. Carry on.
Hello, Peter. Hello, everyone. And thank you so much for joining us. We so appreciate you tuning into our shows. And as always, please keep your comments coming. We so enjoy reading them. And if any of you is interested in being interviewed on the Yakking Show, please reach out to either Peter or myself. We would be honored. And yes, Peter, we do have another special guest with us today. His name is Tim Frye, who is with the Canadian Mental Health Association, Waterloo-Wellington. And we will have him tell us more about that. So welcome, Tim. How are you?
Thanks for having me, Kathleen. Hi, Peter. Thanks for having me. I'm great. Thank you.
So Tim, why don't you tell our audience a little bit about your background and what you do and your role within the CMHA Waterloo-Wellington?
Sure. Well, I grew up in Guelph, just outside of Guelph, so locally, and I ended up going to university on the West Coast to study Japanese. And from there, I ended up going to Japan, actually, for quite a while, where I lived for about 6 years.
Oh, interesting.
So when I was there, I was an English teacher, but I was also a recruiter for IT professionals in the finance industry. But I didn't really like that job a lot, to be honest. So I came back to Canada and I got a adult education degree and a human resources certification. I had my first stint as a job developer in employment services at Lutherwood, which is an organization in the area. They're quite well known. And so I was in their Guelph office assisting at-risk youth to enter the job market there. So now I'm at Links to Work, which is the part of the employment services team at the Canadian Mental Health Association, Waterloo-Wellington. I'll probably say CMHAWW from now on. It's a bit of a mouthful.
Okay.
And so what I do there is I help individuals who identify as having a barrier to employment to reach sustainable, paid, and competitive employment in with local employers.
Wow. I see. Now, how does the service there differ from a regular placement service?
Sure. There are, of course, different areas of employment services, and there are quite a lot of different services out there. A lot of other services are able to provide some really robust training opportunities and are able to provide opportunities to employers for job fairs or to post their job descriptions on their job boards. We're able to have a little bit more of a specialized approach. So we deal individually with the job seekers, and we try to take it at the pace that they feel comfortable as well. So one of the things that we find is really important is to kind of foster that trust relationship so that the person can really get a lot of motivation in their job search. As people who have done a job search know, it kind of sucks. So that's a big component of the job as well.
Wow, very good. Tim, we're going to ask you more about the services that CMHA provides, but something you said earlier leads me to ask you a more personal question. You spent 6 years in Japan and you'd studied Japanese. I gather you were fluent in the language when you went, but even being able to speak Japanese, did you still find it a huge culture shock moving to that culture?
It was, in a way, but perhaps in a different light than many might think. When I was studying Japanese in school, I was also studying culture and language and the political system, history. And the culture shock that I received when I went there was more the culture shock when I saw the real Japan, as opposed to the Japan that the history textbooks that have been published wanted me to see. And it's not that one was better than the other, it was just quite different.
Different, right. Interesting. What was one thing that struck you as being completely different to our life in Canada?
There is a stratified level of language in Japanese that's really that really solidifies the hierarchical structure within their society. There is certain words that you must use when you're speaking to someone of a higher social status, and there's words that you can use when you're speaking to someone of a lower social status. The verb endings, the verbs themselves, they're all different. And so you have to always be careful and aware of the social status of the person that you're talking to, if you're going to be able to speak as well as possible.
Sure. Very interesting. Wow. I better get back on track, but I was intrigued as to your comments on that one. So how do you go about going back to CMHA now, which a lot of our audience will be very interested in? When someone comes to you, a client comes to you and says, you know, I really need to find a job, and they have some mental health disability, whatever you want to call it, how do you go about finding them suitable work?
Sure. There's three kind of teams within our employment services team that we have. And the first team is called Bridging Employment Supports. And they'll help someone who may not have a job goal or may be a little bit unsure of their job goal to determine what it is that they can do, what it is they want to do, and what a reasonable job goal would be. They are also able to provide community supports to the person that might need to be put in place before going out to actually search for a position. Then for individuals who have a job goal and are ready to look for work, the links to work where my team comes in. And then there's also a team called New Directions, which helps individuals who need a little bit more intensive support. So in links to work, then we help individuals in a variety of ways. The way that we would help clients is mostly by coaching and counseling. So we would help individuals to learn how to do a job search to their most effective, to the best of their ability. And then also some strategies to maintain your own mental wellness while you're doing a job search, because like I said before, job search sucks.
Yeah.
So there are some of those components that we can help with, but also more specifically things like resumes, cover letters, interview skills, how to market themselves to employers in the best light. And then one of the other things that we can help with is to have disclosure or accommodation conversations with either employers on the behalf of our participants, or also coach them how to have that conversation themselves.
Right.
So you actually also work with not only your clients, but the employers as well, the potential employer.
Yes, if possible, it would be based on the willingness of the employer and the participant, but that's the best situation, I believe, is where I can have a relationship with the employer and really kind of make sure that things are set up well for both the employer and the participant to succeed.
Is there a process that your team goes through to match a client to a prospective employer?
It really depends. Sometimes we'll be able to find a job description online, and we'll say, we'll go through a vetting process. We know the skills and the abilities of the people that we support, and so we'll be able to do some pre-screening in that regard. What I really prefer, though, is to have a bit of a discussion with the employer to learn not only what's written in the job description, but what is also important in terms of the soft skills, the values, and the organizational fit. So after doing a bit of that needs analysis, it's a lot easier for me to understand if someone that I'm supporting would be able to fit there, and then I would be able to make a recommendation. our service is quite small, so we don't have a plethora of individuals to provide for one particular job posting. So we really like to make sure that that fit is there.
Mm-hmm. Right. So with the shutdown, Tim, how's that affected employment prospects or the employment situation for your clients, for people that come to you for support?
It's a volatile situation, right? The economy is who knows what's happening, and who knows if a second wave is going to hit. So there's a lot of uncertainty out there, not only for job seekers but for employers as well.
Sure.
A lot of the positions that we're seeing at the moment coming available are still in the, you could say, frontline areas where there's a lot more contact with the public. And those types of positions may not be the best for some of our participants. But also we have people who are, they've been unemployed before COVID and still looking for a job, and COVID adds to that.
Sure.
Then there's people who have lost their job because of layoffs for COVID, and who knows if they're going to be called back, so they're worried. And then, of course, employers are unsure of their capacity to hire or what the best practices might be to hire moving forward. So it's made for a lot of uncertainty, which has decreased our intakes slightly recently.
Right.
Now, in lieu of the fact that, I'm looking at post-shutdown, and basically work has changed now, and a lot of people are going to remote work, and it's becoming more acceptable for employers to just have employees work from home. Do you see that as a hindrance to the people that you work with, or is that possibly a better opportunity for them?
That's a good question. I think it would really depend on the person. There are some people that working from home is a really great option. Perhaps someone with mobility challenges or other things might find working from home really great. But there may be other individuals who have lack of access to technology, or they have some challenges with technology where the online application process and then also setting up the technology to work from home may be a challenge that they feel is, I don't think I'll apply to that position. It might be too much kind of idea. So working to kind of overcome some of those things would be important. But I also think that as more of the economy opens up in other sectors that are less public facing, there'll be more opportunities moving forward.
Yeah, that's good. Good. Tim, here's one. It might be a little bit of an edgy question, but it's one that appeals to, that I'm very interested in. I'm getting fairly old, long in the tooth with a grey beard. But if I could think back 60 years, 55, 60 years when I was a kid, people with physical problems suffered from stigma. They were not as accepted as they are now. Whereas nowadays, anyone with a physical challenge is, as far as I can see, not considered disadvantaged at all, except in terms of mobility, right? But it seems to me that the people with mental challenges have lagged behind in that acceptance in the public. There's still a degree of stigma attached. Am I just listening to the wrong channels, or is that still a problem, do you think?
Yes, I would agree. Me personally, my views on mental health may not necessarily be the same views as Canadian Mental Health Association, sure. Waterloo-Wellington, but yeah, I agree that there is still a large stigma in the workplace, particularly related to what you might call invisible disabilities.
Right. So
things that you can't see. It's very easy when someone says, "Ouch, I have a headache," or look, I need a ramp installed.
Yes.
But when someone is describing something that you can't see that's going on inside of them, that's a lot more difficult to deal with.
Right, right. And we interviewed a person on Monday who cares for caregivers or teaches caregivers how to look after themselves. And she related a case of a guy who was in the military and was, to every intent, completely normal until he was getting towards middle age. And then something happened and he developed severe mental problems and could no longer work. And that came on, towards the middle of his life. So it was not something he'd grown up with. is that a fairly common thing, or is it generally people with issues have had them for a long time?
Again, I'm not really a mental health clinician,
Sure.
so it wouldn't be I wouldn't know, to be honest, that
Okay.
type of answer. But what I could say is that case sounds like a bit of PTSD from
Sure.
my own just reading of books, right?
Yeah. Sure.
And so I think it really depends from person to person. I think it's important to point out that most people, who have mental challenges or disabilities, there isn't much that's needed for them to be able to be completely functional and very productive in a job.
Right.
Things that cost less than $100 to $0 is usually, the only thing that might need to be put in place to kind of augment what they need to do.
Absolutely. Kathleen, can I jump in with another quick one?
Absolutely. Go
And
ahead.
this is moving a little bit away from the job situation, Tim. I have a slight involvement, I had, with the CMHA in Woodstock, in that when I was a member of Toastmasters, the CMHA very kindly let us use their meeting room to hold our Toastmaster Club meeting. So I got to speak to some of the people, and I think we actually helped out on something. I can't remember now. But the CMHA offers a lot of other services for people other than finding work, correct? Would you like to talk a little bit about that for people who may well be
Yes.
interested?
Yeah, and again, I don't know a lot about those various services, so I would suggest that if viewers are interested, that they would, again, contact the number that I think you'll be able to put on scrolling there. But yeah, the Canadian Mental Health Association, Waterloo-Wellington, is in the area to help various, people from infants to senior citizens who identify as having mental health challenges. There are several different things that we have going on right now, I think, that are probably quite salient for the time. One is speaking to the topic that your previous guest had. There's a website that our mental health promotions and education team has created called Here for Healthcare. And I hope that website will be able to be scrolled as well. And that's a website that provides free information, psychiatry, and various counseling for healthcare professionals. And you can do a self-referral. You don't need to have a doctor's referral to access that service. They've also instituted another very helpful informational resource called Here for Help, which is also a similar COVID-19 related resource center that also has a section related directly to employers. So there's various COVID-19 related information for employers there as well. We also have a number that we run in the area called Here 24/7, which is a crisis and information phone line. So it's for people who are in crisis, but also for people who are interested to learn more about various services within the area that are related to mental health, addictions, and housing.
Okay, that's good. I'm going to ask you another one. We still have a little bit of time. So we spoke about stigma a little earlier. What can we do, people who believe we don't need your services, and the men in the street, men and women in the street, and we get all ages listening and watching our podcasts. What would you suggest that the ordinary people, everyone, can do to A, help get rid of the stigma, and B, help your organization?
So the COVID epidemic, I think, has really helped with a bit of a silver lining for mental health and the cause of mental health, because the fourth wave of the epidemic is the mental health wave.
Right.
So I think that there's going to be a lot more talk about mental health, and it's going to be on the table a lot more. And I think that's a really important way to decrease stigma, is to have more conversations about mental health. And to everyone out there as well, talking about it is very important. So if you're feeling, that you're having challenges with mental health, one of the most difficult, but also the most important things to do is to reach out to someone.
Right. Absolutely.
But I guess to answer your question, you know, the regular people out there I think the main thing is to just view everyone as an individual. And I think, you know, 1 in 5 people have been said will have mental health challenges in their lifetime. And now with COVID, it's probably, you know, 5 in 5. So
Absolutely.
A lot of the things that you can't see going on with someone, you know, as opposed to maybe a visible disability, keeping an open mind and treating everyone with the level of respect that you would like to be treated with as well.
Absolutely. Yeah, no, you're right. And I know that if I look at myself, sample of one, at times I have thought to myself, yeah, you know, things are really rough. Maybe you need some help here. And I think that could be true of a lot of people if they're honest. We all go through bad patches, let's put it that way. And luckily,
Absolutely,
some of us
and the
come
mental
out.
health, you know, diagnosis isn't necessarily the end of the world. And
Sure.
I mean, on a personal note, I have a ADHD diagnosis as an adult, and so the learning process that I have gone through with that, in terms of the things that I can do to help myself to operate at peak capacity, and also what I can do to use some of the things that ADHD gives me to be productive. You know, I think that that's really been helpful for me in my journey. And so, you know, people like Richard Branson have ADHD, Richard Churchill, Winston Churchill had, you know, very difficult depression.
Yeah.
So, you know, there's a lot of potential there as well, and that can be realized in the workplace.
Sure. Kathleen, over to you.
Well, we will be captioning, of course, at this video how to reach you. But so to our listening audience right now, how can they reach you if they want to get connected and there are people out there that are looking for work? How do they do that?
Right. So the way to contact the links to work and the bridging employment supports and the entire employment services team at CMHAWW is to call, and I think you'll caption it, 519-749-3730.
Okay.
And the extension is 4087. And that's how to reach us at our team. There's also the website for the Canadian Mental Health Association, Waterloo-Wellington, that I hope will be displayed.
Yep.
And that's a great resource as well. If you are in crisis, or if you're also just interested to learn what different mental health addictions and housing services there are in the area, then the Here 24/7 number is the right number to call. And I believe that's 1-844-HERE 247. I'm sorry, I'm not sure what the HERE is, but that's the same numbers. Yeah.
Excellent.
We'll fix it.
Thank you.
We'll do that, and then we'll put all that up there, and people can use those if they should get hold of you. And I would encourage employers too, who maybe could provide employment for one of your clients, to get in touch with you. What about, I know that CMHA is always looking for funds, and I think in the past there's been runs and walks and other fundraising activities, which of course are on hold at the moment. Is that part of the program to help CMHA?
Absolutely. We've done quite a few different fundraising programs in the past, and we also at the moment, I believe, are working on a run. I'm not sure how long. I believe it's a run for women, and it's going to be in connection with Shoppers Drug Mart. But don't quote me directly on that. That's an area for our community involvement officer. So there would actually be a lot more information on our webpage about that. But we do various fundraising activities from time to time, and the Run for Women is coming up.
Thanks, Tim. So we would encourage our listeners, our audience in Canada, and not just in Wellington and Woodstock, but anywhere in Canada where there's a local CMHA, if they have a fundraising event, a run or walk, please get involved and help the organisation out. From my knowledge of the organisation, it's really good. It does a wonderful job for many Canadians. So I think we should all support you. And that's about all I've got. So I'm going to hand back to Kathleen.
And I think we're just about out of time, Peter, and
Yeah,
we
okay.
thank you all for joining us again. Thank you so much, Tim, for that information. I'm sure our audience will find that most valuable. And once again, if any of you is interested in being interviewed on our show, please don't hesitate to reach out to either Peter or myself. Thank you so much, and we'll see you again next time.
Thanks, Kathleen. Thanks, Peter.
Thanks, Tim.